Morning.
Morning.
Hey, Anthony. I can't remember why you gave this back to me. Office, and you didn't sign off on it. I thought, were we having her do Unicode or what was that?
Maybe that was what it was.
Oh, okay. Thank you.
Okay, I've got 10:30. Welcome, everybody. We'll go ahead and get started. Work sessions are an opportunity for board members to discuss issues informally with staff and invited guests. The board encourages members of the public to attend work sessions and listen to the discussion, but there's generally no opportunity for public comment. Members of the public wishing to address the board are welcome to do so during the board's regularly scheduled meetings held twice monthly. Got 5 items on our agenda this morning. First off, I just want to thank everyone on the county commission and staff for condolences and for flowers that I received and the support for my family. My mom passed away last Friday, but it's really nice to have this outpouring of support for my family. So thank you so very, very much. And I'll turn it over to our county manager for the county manager update.
Thank you, Chair Quayla, members of the board. I did want to share that there's a 6th item, Chair, that we're going to try to get to, which is a discussion about the BIOP. Staff prepared a letter. I sent it to the board yesterday as a draft that we're working with the cities to try to get a letter together that would be supported by all the cities and the county that we can submit as part of the public comment period. So we're going to talk a little bit about that as the 6th item. We won't take too much additional time, but it's an important topic, and the public comment deadline is at the end of the week. So thank you, Chair.
Yeah, thank you, County Manager, and I appreciate you making that addition. That's very important. So I'm glad we're going to have that discussion today. First item is the public safety update. And I know we have Sheriff Matt Phillips and Astoria Fire Chief Dan Crutchfield joining us. And I'll go ahead and turn it over to Sheriff Phillips.
Good morning, Chair Quayla and members of the board. Thanks for having me. It's a sunny day and it's actually a pretty good time to be in law enforcement right now. Back in 2020 when the pandemic hit, and then there was a lot of unease nationwide about the community's relationship with law enforcement. There's a corresponding change in legislature and it made it kind of a difficult time for a lot of law enforcement officers and you know, industry wide, to include Clatsop County. We had people leave the industry, and it became a harder time to recruit. And we did some really grassroots guerrilla marketing to recruit people. You know, in the last 2 years, we've hired about 20 people amongst all of our 6 divisions, and really got some outstanding people. And I give credit to the existing staff, because we really kind of put it on them to go out and find the people in the community that have ties to our community, that care about our community, to you know, go out and recruit them to work for the sheriff's office. And we really did a good job at that. I'll do a quick kind of overview of what's going on in each of our divisions, and then try to leave some time for questions. In parole and probation, we started a gender responsive caseload, so that is specific to the females that are on supervision. It is staffed by a female PO, and we know that the ladies have different needs. And so that's been really successful. I've been seeing some good outcomes from that. Our 3 specialty courts, we're seeing the enrollment or census in those programs increasing, and those have been really effective. One of the changes the state has made is they basically decided not to fund a whole bunch of cases that were previously funded for supervision. And so that has brought down the number of people on supervision statewide. So then what they do is they reduce funding because there's less people on supervision. And so we're looking at a $471,000 loss the next biennium in the parole and probation. And so I mean, you could look at that as like 2 positions. It could also mean some of our programming. Currently, we have a contract with CBH. We have a dual diagnosis clinician with an office here at the sheriff's office, so that there's easy access. You know, no excuses to miss an appointment with your treatment provider. And you know, that's been a really effective program. I'd hate to see that go away. And we also know that part of the reason the number of people on supervision is low is the giant backlog that occurred in the courts during COVID. So the projections show the census coming back up in 2 years as some of these backlog of cases get resolved. And you know, we can't lose people, you know, lay them off and then hire someone and train them up, which takes at least a year, and really 2 to 3 for good competence. So that's really unfortunate. Currently, we have 1 open position that we're deciding not to fill at this time. And then, you know, we're just being really careful with the money that we have, and we're going to do our darn best to weather this storm until we get better funding from the state. In animal control, I'd encourage you to swing by there. We've done a lot of projects. Last year, it got a new roof. Recently, we redid the parking lot and expanded some parking for the volunteers in the back. Our new supervisor, thank you for that. He's a sworn deputy with the rank of sergeant. He is more expensive than who we had running the program before, but he's been able to handle a lot more of the animal investigations that are criminal in nature, which takes quite a bit of load off of the patrol deputies. And he's also built a ton of really outstanding relationships. Sometimes we get dogs that are hard to adopt, and he made a relationship with a shelter in Idaho, and they work together. And if they have dogs that just are not getting adopted in Astoria, and some that just aren't getting adopted over there in Idaho, they'll drive and meet and switch dogs. He's also started a canine training program, because some of these dogs have some behavioral issues, and he's working with the volunteers and the staff there to train these dogs to make them more adoptable. I really appreciate Justin. He's really calm and focused. He makes good decisions. He finds problems and fixes them on his own, to include like a water line that's been leaking for years. I mean, he kind of noticed there's a wet spot and slowly increasingly higher water bills over history. And so he started sniffing around until he found the leak. So little things like that really do make a big difference. Currently, there's 80 active volunteers at the shelter. In the corrections division, We're fully hired. That includes all of our deputies, nurses, and control room technicians. The new facility has been really fantastic. We got our feet under us now, know how to operate it with the extra space. The living conditions and the corresponding behavior of those in our custody is way better. We've only had one minor fight in the time that we've been there, and typically in the old jail you'd see one a week or one every 2 weeks at least. So that's a lot better. Our medication assisted treatment program, which is a collaboration with Clatsop Behavioral Healthcare, has been really fantastic. It is time intensive, but it seems to be making a real difference for those people that need it. We're getting reports from families saying that their kids are coming out of jail and not immediately relapsing. They're staying on the program and staying engaged with the CBH treatment providers. So that's really positive. And the best thing is CBH is paying for it. It's nothing out of pocket. We're currently looking at expanding this program with some telehealth, and there's potentially some revenue from the CCO that would provide a clinician to work in the jail close to full time to help manage that program and take some of the load off the deputies from having to manage it. Let's see. Oh yeah, and we're also looking at increasing the number of prescribers. Currently we have Dr. Van Duzen, who is our contract medical director, and then we have the CBH doctor. But what we find is when people, that only covers like 2 days a week for prescribing, and when someone comes into custody, they need to start on that medication assisted treatment program rapidly to manage the withdrawal symptoms. I'm sorry. And so we're looking at expanding to telehealth to get another prescriber. The support division has been really busy working on the Measure 114 work group. In fact, Lisa Miner, who's our support division supervisor, she was kind of the, they didn't say president, but she was the ringleader for the implementation planning. So if this law does come into effect, the Sheriff's Association has much of the background, at least our portion of it, done so that we can roll it out to the police departments to support that as well. Public records requests are way up. Historically, we get about 10 a week, and now we're getting closer to 10 a day. And that has been very staff time intensive. We're getting a lot more requests for videos. By law, we have to redact the video, the faces from the videos, and that's expensive and time consuming. So that has been a change. Small claims and evictions are continuing to go up as well. Subpoenas are up. That's because the courts are starting to become busier. And CHL permits went way up when Measure 114 passed, but now it's kind of leveled off, but it's still high. Let's see, the medical examiner's unit. This year we had 252 investigations. That was up 16% from last year. Scene investigations also went up by 40%. We had something that was kind of remarkable. Accidental drug deaths is up. We had 16 and 22. 7 of them were fentanyl overdoses in just November and December alone. And we only confirmed that data last week because the state ME's office and the toxicology has a massive backlog. So we're only just now getting those results. So that's a kind of a sad deal. And then Teresa, we'll talk about enforcement real quick. I have 3 slides. Teresa? Oh, there we go. Awesome, thank you. So Measure 110, this relates to the enforcement division. This will show you that since the law went into effect in February of 2021, there's been about 4,500 citations written for possession. And part of the promise with Measure 110 was that instead of getting arrested, you'd get the citation, and there's a path to treatment. The treatment really consists of calling and getting a health screening on the phone, and if you present that to the court, then they'll waive your ticket. And so, I'm not sure that a health screening really is treatment, but that's what the law provides. Only 42 people out of 4,500 have actually done that. There's no penalty for not going to court. So there's really not much of a compelling reason to participate in this program. So that's challenging. And I think I told a story earlier this morning. About 2 weeks ago, one of our deputies pulled over someone who we knew is a known prolific drug dealer. He's moving a lot of drugs in the community. And just in jest, the deputy said, "All right, well, why don't you just give me your drugs?" And he goes, "Okay." And he hands him a tin with 30 fentanyl pills in it and an ounce of methamphetamine. And there's nothing we could do about it because legally we'd given him an unlawful order, even though it was just a joke. The guy actually did it, and so we just had to destroy it. So that's pretty challenging. Next slide. Commissioner Webb was talking about crime data, and so we report that through ONIBRS, which is Oregon National Incident-Based Reporting System. We report it nationally as well as to Oregon. Oregon has a few more categories they like to collect information on. So person crimes is going to be everything from murder on down to assault. You can see that it's pretty stable. We saw a little dip in 2021 and then an increase, but still below what was in 2020. Property crimes, which would be robberies, which in Oregon is considered actually a person crime, but the way we report it, it's property, theft, burglary, arson, things like that. You can see that we've seen a pretty steady increase. Kind of the ironic thing that I would say about that is when we decriminalize the drug possession, we're still seeing the same people coming into custody, but now for more serious crimes. So I don't know if that's beneficial to them or not. Society crimes, you can see that we've seen an increase in those. That would be things that represent society's prohibition against certain types of behaviors. Not that we arrested a lot of people for gambling, but it's gambling, prostitution, animal abuse would be one. Child pornography would be a society crime. So we've seen an increase in those. And then the other category where we've also seen a steady increase would be traffic crimes, marine violations, retrieving stolen property for other agencies, hit and run, eluding police, things like that. And then on the topic of uniform crime reporting is the next slide. And the LEOCA stands for Law Enforcement Officers Killed or Assaulted in the Line of Duty. Fortunately, we've had no line of duty deaths. But the blue would be the incident, and then the orange is the number of officers assaulted. Because sometimes there's two officers or deputies on scene, and they both get hurt. So 2020, you can see that we've had kind of a fairly steady decrease, which I think is a really good thing. I think that it may be, that we're getting better at de-escalation. I'd hope that that's what the result is here. But I don't know what the exact cause is for seeing the decrease, but I'm more than happy to see it. So that's just kind of my crash course in what's going on at the sheriff's office and kind of our community at large. Any questions?
Thank you, Sheriff. Appreciate the report. I see that Commissioner Thompson has a question.
Thank you, Mr. Chair. Thank you, Sheriff. I'm glad to see you here. I hope that we can do this on a quarterly basis, because I think the work that you do is should underpin the work that we do. As I look at these data, it seems to me that there is an increase in lawlessness. I don't know that there's anything we can do. We county commissioners can't impact ballot measure 114. We can't create funding from the state, but how do we support more lawful, more good neighbor conditions in Clatsop County? If you have recommendations, I'm interested in hearing them.
Well, I think that it's a really big issue. You know, what we talk about stigma related to a lot of things, and destigmatizing can be really good, but sometimes I think maybe it goes too far, and that there are social norms that I think that that people shouldn't violate, right? And resulting, if you violate the norm, you should feel embarrassed, and I guess that's stigma, right? So I feel like a lot of our social norms about what constitutes appropriate behavior are changing. You know, Oregon's always had very permissive attitudes towards substance use, and I don't think we should be surprised that we have a high incidence of substance abuse. So I think it really takes the whole community. Society is a complex ecosystem, and law enforcement is just one little tiny piece of it. It's one little check and balance to the whole thing, and it really takes everybody to row in the same direction to make change.
If I could do just one follow-up, Mr. Chair.
Absolutely.
County manager, we haven't as a board, I think, defined, and maybe I'm just not remembering correctly, these kinds of issues, the social norms related to lawful behavior and being good neighbors and that sort of thing. As the sheriff points out, it's a complex ecosystem. I don't know if there's a way to look at public health and law enforcement and county leaders in order to address issues like this. But I wonder if I could put that in a basket to create more attention for that the next time we're looking at our strategic plan, or if we're looking at updating during the year. Thank you.
Thank you, Commissioner Thompson. Commissioner Webb?
Yeah, wow. I certainly second Commissioner Thompson's concerns on this. I guess I have a couple of hallelujahs for you, Sheriff. The animal shelter is, as you know, is one of my passions. And my little buddy is right next to me here, who's a shelter dog. Honestly, it is operating so well right now. It isn't just the new roof. It's a lot of great effort on people's parts, and it's just come so far in such a short period of time. So congratulations. It's really been terrific. Thanks for the crime data, you devil. It's taken you a few years to get this on this screen. And I'm not going to leave you alone about it. But thank you. It's rather concerning. And I'm wondering, and this might be the same question that Commissioner Thompson asked, but what can we do to help you at the state level? I don't recall that we put a lot of these law enforcement issues into our grab bag. County manager, help me out here if I'm wrong. And of course, this has been a very chaotic session. So please, let me just leave it. Please let us know when there are things that we need to be advocating for you. I'm always concerned that this state does not pay enough attention to funding law enforcement in rural areas. That's just, a lifelong concern, I guess. I don't know how we get around that. I don't know what we do about it. And then I do have a question for you about the death investigations. I don't know whether I just read too much garbage news, but it seems to me that there are an awful lot of people in this country right now, young people who are dying suddenly. And we often find out that it wasn't intentional, that it's this awful effects of fentanyl in so many of our different medications. Do you agree with that? Are we having are we having any death investigations where the cause is, could be attributable to bad drugs, but we don't know for sure? I mean, does that cost us money to go down that hole of investigating blood and things like that?
Yeah, so it's kind of a two-part question. So I'm not aware of any cases where people had counterfeit pills that they thought were legitimate prescription, right? I was recently reading a story about a mother who lost her 17-year-old son, who for whatever reason thought he would try an oxy that he had procured illegally, and it wasn't oxy at all. In his search history was like, what's the safe dose? What, how much can I take? And so I think that's something a little bit different. We do need to determine the cause of these unnatural deaths, and part of being able to put on a death certificate the manner and cause would be the toxicology.
Mhm.
So the ME does have to go through that process. As far as the illegal fentanyl that's on the streets, not that long ago, they were $10 a pill, or maybe 20, and it was 10. And now we're getting reports that you can buy them on the street for $1 to $2. One of the corrections deputies was just talking to a guy who came in and he had recently overdosed. He'd smoked 5 pills in a row with no effect, and the 6th one was where all the fentanyl was. And he, tipped over and had to be resuscitated. So that's kind of the scene out there. We're talking to people that are doing 100 plus fentanyl pills a day. And of course, such a tiny amount can get you very, very impaired. And there's the way they mix the ingredients is they need some sort of binder to make a sellable pill, right? So you got, a tray full of cellulose or whatever, and then they just kind of sprinkle some fentanyl in there, mix it up 2 times, and then press it into pills. So it's not evenly distributed throughout that batch, right? So that's why it's so inconsistent in the strength of what's being delivered on the street.
So what we're hearing is all true.
Yeah.
Thank you. Thank you very much. I hope you'll come back regularly. It's wonderful to have you.
All right. Thank you.
Thank you, Commissioner Webb. And I assume that my fellow commissioners saw a email from Chair of Clackamas County Board of Commissioners. And they are actually referring Measure 110 to the voters in May 2024. They're asking the legislators representing Clackamas County to introduce past legislation repealing provisions of Measure 110 that decriminalize hard, illegal drugs for juveniles especially. And then they're asking if Governor Kotek should call a special legislative session to address Measures 110's drug decriminalization and its impact on crime and homelessness. So it looks like that's the approach that Clackamas County is taking. It might be something that we want to discuss soon, and maybe we can do a work session in the future to talk about some of the impacts of Measure 110 and what we can do about it. And if we want to do something similar in Clatsop County.
Wonderful.
And I know that Chief Crutchfield is here as well. And Chief, I will go ahead and turn it over to you for your report.
Well, good morning, commissioners, and thank you for giving me a few minutes to briefly talk about the fire service here in Clatsop County. As you said, my name is Dan Crutchfield. I have the honor of serving as the fire chief for the city of Astoria, and I was also selected by my peers, the other fire chiefs in the county, to serve a 3-year term as the Clatsop County Fire Defense Board chief. I just have several topics. I was going to kind of give you a brief overview, a little quick discussion, and then I'll try to leave a few minutes too at the end. If you do have any questions, I'll do my best to answer. So a topic that you probably saw in the paper in the recent months was talking about the ambulance service area and our medics ambulance and some of their issues with delays in response times. And the fire service has been working closely with medics. Obviously, that's an internal personnel type issue. They're struggling to hire paramedics and keep their ambulances staffed and keep more on the road. The problem that causes for the fire service is we get stuck waiting for them on scene. And when those firefighters and apparatus are at that scene, we are obligated to not abandon our patients. And so we remain there to continue to provide care until we can pass it on to an equal or higher level of care. I want to be clear. I think medics and Tom Strecker are doing the very best job they can. I think we all face challenges with hiring in this day and age, and volunteerism, which I'll get into here in a little bit. I know they've recently put on some traveling paramedics to help increase their staff, so they are definitely working on it. In Astoria, we've started using a couple of years ago a chase vehicle. So we send an engine, but we're also having a pickup respond as well. So if we do, sometimes we'll have 2 or 3 calls all within a very short period of time. That allows us to let some staff leave the scene while still taking care of whatever patient started the first call. The other thing on this topic is that you may be aware of, but the city of Seaside has purchased an ambulance, and they've entered into an agreement with medics where if medics is going to be 10 minutes or more delayed, then Seaside has the ability to transport those patients. The other win I see in that agreement is medics in the event of a mass casualty type incident where multiple people need to be transported, there would now be another ambulance located in Seaside. I believe per that contract, they would reach out to Seaside and say, hey, we need you to go to Napa or Astoria or wherever this event is. So I think there's a lot of good conversations and a lot of good work happening. It's certainly an issue, but it's an issue that we're well aware of and working, together to try to solve. Dispatch has been another topic. So for several months, there's been work group type meetings, just talking mostly about personnel and equipment. As you know, there's a dispatch center located in Astoria, a second one located in Seaside. And I think the big conversation is really around personnel and equipment. And if we train our personnel at both centers the same, it creates some redundancy. Also, if we're equipping, that equipment ages and really gets out of date. And I think it's important, they have the opportunity. It's a lot of money, but they need to, work on updating their equipment. And to me, and I think to the group, it makes sense that both of those centers are working together to identify the right equipment and trying to do the same thing. I think what's important about that would be is, let's say there's some sort of catastrophic failure at one of the centers, you could move personnel to the other center and they could take over dispatching for the entire county for a period of a few days until the problem was resolved. I think training people the same and equipping people the same drastically makes that a lot easier process. So a lot of ongoing talking, and that work group is still having many discussions to try to determine what's best for dispatch. I can tell you that the overall consensus of the fire services, we would all really like to be dispatched by one dispatch center. The challenge for us is if there's a significant event in Seaside, that dispatch center will dispatch those South County units. At some point in time, they have to notify North County that North County units are needed, and then they have to dispatch North County units. Excuse me. And there's been up to 8 to 10 minute delays in that communication between the centers and getting other fire departments moving south or moving north. And if it all came from one dispatch center, it would all happen, at one time. It takes out one step. So we have good things happening. good discussions happening. Again, I think we've identified some of the problems and we're working through to find the best solutions to move forward with dispatch. The other topic I wanted to discuss briefly is fire season. So Clatsop County went into fire season on June 14th at 1 o'clock in the morning. That does mean that burn barrels during daylight till 10 a.m. are still allowed with permits. So if you live within a city, reach out to that city and get a permit. If you live in the county, reach out to the Oregon Department of Forestry and also get a permit. Recreational burns are allowed. So if you want to burn firewood in a fire pit in your backyard with a permit, that's still allowed at this time. I did want to share, it's been generally dry. We've had a little bit of moisture in the last few days. This was early for our county to be going into fire season. I think it might be a bit of a challenging fire season personally. There is some talk of our Northwest region going into high fire danger as soon as July. And that would be something I think typically we see more mid to late August when it occurs. So the people that are in charge of this, the Oregon Department of Forestry, are keeping a close eye on it. We take, they take the lead and let us know, but we are united as a Clatsop County Fire Defense Board, and we will take their recommendations and work closely with the Forestry Department to do whatever is safest for the community. And we try to all do the same thing at the same time to make it easy and understandable for all of our residents. I also wanted to share, excuse me, on the wildland type situations. All firefighters in Clatsop County, all structural firefighters do receive training in wildland firefighting initially in their training, and then annually we all do refresher training in this area. And so we are capable of handling incidents within the county. If it were to become much larger and become a conflagration, that order would go through the fire marshal's office and through the governor's office, and then resources from around the rest of the state and maybe even other states would come in, and then they relieve all of the local responders. So we go back to our stations and resume providing coverage in our local areas, and the other people would take care of that fire. We also do that same thing around the state of Oregon and other states. So we participate in the conflagration program where Clatsop County will send task forces out to other areas of Oregon and typically California. That's generally about 5 to 6 pieces of apparatus and about 15 firefighters when we do that. But what I wanted to really stress to you guys is protecting our home front is always the most important thing to us. So when we send those resources out, we always make sure that we have plenty of resources left here in Clatsop County. And I wanted to talk about staffing a little bit. There's also been some articles in the paper recently about this. I would say every fire department is looking at how they increase their staffing, and that means both career and volunteer. I'm 30 years into this career this month. And, for the last 15 or 20 years, recruiting and retaining volunteers has been a challenge, which has just gotten worse and worse and worse. And I think it's attributed to many things. Life is busy. A lot of times nowadays you have dual income families where both, potentially parents are working. You have kids, sporting events, maintaining your house, taking care of your jobs. It becomes difficult to find the time to be a volunteer firefighter. So a lot of agencies, including here in Clatsop County, are that were very prevalently volunteer, are hiring more and more staff. Cannon Beach, for example, has been hiring quite a bit. Seaside Fire has been hiring. I was fortunate enough to add a deputy chief 2 years ago almost, and we are looking at grants and other opportunities to try to hire some more firefighters here in Astoria. As our it's probably the same for everybody, but in the last 2 years, my call volume has increased 25%. So, and then, regulation and different things, different standards that we're supposed to meet, all of that increases every year. So there's more and more work to do with what seems like less and less people. So we are working hard. All of us are working hard to still try to recruit and retain volunteers. I think that's a deep rooted tradition in the fire service. I think we'll always want volunteers if we can find them. But looking at grants and things, to help us adequately staff our fire departments. And then the last thing I'll leave you with before any questions is I just really want, to share my appreciation for the fire service here in Clatsop County. I consider myself an Astorian, although I've only been here 4 years. I came from Coos County. I feel like the fire service there was pretty good, but honestly, there's a lot of really amazing things that happen here. How well we work together, not only internally as a fire service, but how well we work together with our community partners. We have a thing called box alarms. It's essentially automatic aid. So for example, in Astoria, if I have a structure fire right now, I'm going to get Napa, Lewis and Clark only, and Warrenton, as well as all of our staff. So all of that, and that's just to begin with. And if I need more people, I can just ask dispatch for a second alarm, and that would even start moving South County north. So all of this is all pre-planned. It makes it super easy for dispatch. It makes it really easy for us. It ensures that we get enough people to a structure fire. I cannot even reiterate how proud I am of the fire service here and how well it works together and what we all do for each other, to make it work. So that teamwork is really an amazing thing to see and to be a part of. And then I guess just lastly, I'll put in there, I mentioned community partners, but in the fire service, there's a lot of times where we get into some pretty sketchy environments, and we can't safely do what we need to do without our law enforcement partners. That's all of our city police departments, the sheriff's office, the state police, who come and make those scenes safe for us. So it's also been amazing to see how well the fire service works with our law enforcement partners. So with that, I wanted to just try to give you just a quick overview of a few things that's been on our mind and leave some time for some questions.
Yeah, thank you so much, Astoria Fire Chief Dan Crutchfield. I appreciate the public safety report and comprehensive report. I know that Commissioner Thompson has a question.
Thank you, sir. Well, I've been waiting a long time for you all to come and talk to us because other people have been talking a lot in my ear. I am so grateful for what you do. My concern is, again, how do we support you so that you can do your job? And when it's a volunteer job, Hamlet Fire District, for example, not a single, zero paid staff. So here's a fire chief who has to do all of that work for no money out of the kindness of his heart and the goodness. Well, I don't know how we need to impact ballot measure 110. I like the chair's reference to what Clackamas County has proposed, because I hear consistently that without sidebars or consequences, law enforcement and the difficulties, the dangers that you face, and law enforcement has guns. Fire folk, no guns, right? Similar danger, perhaps more so, because there's conflagration, there's medical issues, and particularly in rural areas, it is a wild, wild west. So I appreciate very much the work that the county manager has been doing to get that consolidated dispatch, because I've been hearing about that ever since I was a commissioner and maybe a little bit before. So I don't know if we have a timeline on consolidated dispatch. I don't know if we have a timeline on moving forward with, I would say, communicating with Clackamas County and seeing what we can do about ballot measure 110. I don't know how we can continue to support you, except that I know on the Seismic Rehabilitation Grant Advisory Committee, I have a seat there and I can advocate in a completely ethical and respectful and legal way for the needs in Clatsop County. So that's what I can do for more money, but I think we all want to help you every way we can.
Well, thank you, Commissioner, and I appreciate all of that. And I'll just maybe touch on a couple points that you'd mentioned. There is a work group in place, talking about dispatch, and I think it's a process. And what I've learned in my years is these things don't happen overnight. And I think it's very important to get everybody on the same page and to really, really think through those types of decisions. And then make sure that there's buy-in, to move forward. And I believe that the process that's being used is very inclusive in getting lots of ideas and opinions and data to drive that decision. So I think we've come a long ways and we're getting close. Probably not quite there yet. A little bit more work to do, but a lot of great work has been done over the last year or so. As far as something that you may or may not be able to do as a board of commissioners, funding for staffing is probably one of the most important things. There are grants out there. The state of Oregon through the fire marshal's office has been providing some grants. And then also the federal government through it's called a SAFER grant does provide some hiring grants. But if you can plant any seeds at a state level or any other level, any funding mechanisms that helps us hire people would be appreciated and amazing. And then lastly, you're 100% right with these small rural fire departments. I believe Hamlet probably has a budget of $20,000 or $30,000 or something like that for the entire year. And you got to think about they got to pay a light bill and a water bill, and they got to buy gas for their fire trucks and have insurance. And they may or may not do a small stipend where the volunteers get a couple dollars a call or something, which probably doesn't even buy their gas. But there are so many requirements. We're required to test our pumps, to test our hoses. You got to maintain your fire trucks. You have to replace the turnout, the protective gear that we wear to fight fires. You can only keep it 10 years, even if it looks brand new. There is pages and pages and pages of rules. And they don't have the money to even be close to compliant, which impacts their safety. And these are people that are volunteering and risking their lives that don't have the money to have the proper equipment. We're fortunate in Astoria where we have a decent budget. And we have enough people where we work really hard, to be compliant with these rules. But there are some of these smaller departments that, let alone personnel, they don't even have the right equipment they need, which is sad.
Thank you, Chief. Commissioner Thompson?
Just a quick follow-up. Thank you, Mr. Chair. So I would remind my colleagues and everyone who's listening to this now or later, when there is a crash, some kind of vehicle collision or trees down on the road or that kind of thing, it's those small rural internal to Clatsop County fire districts that show up. It's those volunteers standing out there in the snow and the rain in sometimes they're high heels, Diane Jenny has been known to do. But the problem is, again, to the sheriff's point about the attitude about law enforcement, what I'm told is that there is aggression voiced toward people out there trying to protect people's lives. So Sheriff, Chief, whatever we can do to help, I want to say inform and reform public opinion to support the good work done by paid staff and volunteers to protect lives and safety and property all over Clatsop County. Help us help you every way you think of now and later. Thank you.
Yes, thank you, Commissioner Thompson. Any other questions for Chief Crutchfield or Sheriff Phillips? Well, thanks again for this public safety update. Congratulations on your 30 years of service, Chief Crutchfield, and really appreciate what both departments are doing. And obviously, I think the community partnerships is a theme that we hear quite a bit, and it is so important that it is strong in Clatsop County. So thanks for all you're doing. We'll move on to the next item, which is the Human Services Advisory Council membership recommendations. That's on page 4 of our agenda. And Randy Anderson, our Human Services Advisory Council chair, is here, and I'll turn it over to Randy.
Thank you, commissioners, for having me. I appreciate it. What would you like to know?
Well, it looks like we've got some applicants for 2 positions. Am I correct on the?
Yes.
Okay.
Filling 2 recently departed members of our council. So they'll fill their terms out. We have Grant North, who is semi-retired. He's an accountant. He's been a citizen of the United States. He's been a long-term citizen of Clatsop County, long-term citizen of the United States, but he's Canadian. He doesn't have his, he's not his citizenship for the United States yet. But anyway, he has concerns about mental health, homelessness, lack of housing. We talked quite a bit. I am the one person on the committee for new participants. And I really like a lot of the things he had to say, and I'm recommending that you take in consideration for his membership on our council. And then we have Kathy Samsel, who has a lot of background history in education and recreation, physical and disability, mental health. She is out at Mill Pond in Seaside at the homeless camp, houseless camp out here every day of the week, providing meals, offering to change bandages, whatever she can possibly do out there. And she is just an amazing person. And I talked quite a bit with her and met with her. And I'm also recommending her to join our council. And that will fill out our 9 membership max.
Okay. Thank you, Randy. Monica Steele, our Assistant County Manager.
Yeah, I just wanted to mention, Randy had spoken to the citizenship of Grant North, and we reviewed with county council, and that is not a requirement. They just have to be a resident of Clatsop County. So citizenship is not a requirement.
Correct.
Yeah,
Yes.
Thank you for that clarification and follow through, Assistant County Manager. Do we have any questions about these applicants or the recommendation? Commissioner Thompson?
No questions, sir. Just a big thank you, and glad to have, do we call him a resident alien? Kidding, little joke. You know, this is daunting work. I appreciate that you're doing it for us. Thank you.
You're welcome. Thank you.
Thank you, Commissioner Thompson. Any other comments or questions? Commissioner Webb?
Whoops, sorry. One of the things that I have admired about this committee over the years is that not only do they work very hard at selecting these grant applications, but they also do follow-up work and often personally visit with the grantees and follow them over the course of time. I think that that for what seems to me to be an awfully small share of our county budget, we're getting an enormous amount of quality service from this council. And I'd like to really shower them with thanks and admiration. Since we're running a little bit behind, would it be possible for us to just move right now? I'm noticing that in my packet, I don't have the motions down, but I think I could come up with one. Would you entertain that, Chair Coelho?
Well, I don't think we'll be making a motion today. We're actually just.
Oh, we're in a
having-
work session.
Yeah, we're in a
I'm
work
sorry.
session. So we're just
I'm sorry.
reviewing and appreciate the presentation from Chair Anderson. And then we will, unless we have any other questions or comments, we can move on to the next item, which is the Human Services Advisory Council grant recommendations and awards to outside agencies. And that will again be Chair Anderson from the Human Services Advisory Council.
Thank you, Chair. We have a grant application committee. We had 18 applicants applied this past year, submitting for $76,500 requested funding. 13 of those applicants were recommended for a total of 30,000. And the ones that were recommending for assistance is the Assistant League for 4,500, the Astoria Lions for 2,500, Bumblebee Daycare for 1,500, Camp Kowanalong for 2,000, CC Drug Court for 1,000, CC Mental Health Court for 1,000, Clatsop Emergency Food Bank for 2,000, First Steps for 1,000, Grace Food Pantry for 1,500, Grace Snack 4,000, Lifeboat Beacon 3,000, North Coast Food Web 1,000, and the Harbor at 5,000, which totals up to $30,000 of the grant application money. So that is our recommendation to the commissioners for funding for this year.
Great. Yeah, thank you, Chair Anderson. Do we have any questions? Commissioner Webb, Commissioner Thompson? I think Commissioner Webb stated it very well. Thank you so much for all that you and the council does. You certainly, we do get a big bang for our buck with with what you guys are able to do, and we really appreciate all your efforts and appreciate this recommendation.
Thank you. I do have one question. One of the applicants was a for-profit and was automatically should have been not even talked about, and because it should be, my understanding, it's got to be a nonprofit to before we even consider them. And I'm wondering if we can get that on the website. I don't think it's on the website where it says that the applicants have to be a nonprofit. So I'm wondering if we could maybe possibly do something about that to help us, and then to help other people who are going to apply not go through the time to apply when they're not going to get funding right out the gate. So just a suggestion.
Yeah, thank you, Chair Anderson. We'll follow up with that.
Okay.
Appreciate it.
Thank you.
Thank you so much.
Thank you.
Okay, we'll move on to the next item, which is a snapshot of Clatsop County's community health. That's on page 128 of our agenda. Jen Chang, our Director of Public Health, is here. I'll go ahead to turn it over to you.
Thank you, Chairman Quayler. And let me bring my slides on. Oh, just disable. I cannot share my slides here.
Does Teresa have your slide? Does Teresa have your slides?
No, I don't, but I gave you permissions to share your screen, Jen Chang.
Okay, thank you, yeah.
There they are.
Which is, sorry.
Yeah, we can see them.
You see, did you see this slide, the snapshot of Clatsop
Yes.
County population health?
Yeah, we can see it.
Okay, that's good. And thank you, Chairman and Commissioners. And I'm going to present this county health ranking to you. And this county health ranking is an annual event started 2010, and I will go through the history and but put my focus on what's the challenges and what are opportunities. And so let me move quickly to next slide. And this is something like already like Commissioner Thompson mentioned that a community is an ecosystem, and the ecosystem and talking about health, and it's really health is within the ecosystem. And this you can see individuals here, and individuals' behavior, lifestyle, affect health, and in a larger scope, social and community networking culture affect health. And outside this, and like physical environment, work environment, employment, and healthcare service affect individuals. So this is really our health as an individual and as a community, and is determined by many, many factors. So next slide. The following all slides will be from this Robert Wood Johnson Foundation and the University of Wisconsin, their publications. And so what including our health and working public health for these years, and I always like to say, yes, your zip code is more determine your health than your DNA code. And here really we can see, and socio-economic factors, and I'm not going to read through it, and physical environment. And if we think about also health behavior is determined by socio-economic and cultural factors. So more than 50% of all our health is determined by the zip code. And then the rest of 20%, yes, your DNA, your health care, and the quality of care is determined. So bring this idea together, and the University of Wisconsin, they put this model there, health ranking models. Their health ranking models idea is, yes, they look at health outcomes and they look at health factors. And health outcomes, they look at the length of life and the quality of life. And for health factors, they put into 4 groups: health behaviors, clinical care, socio-economic factors, and physical environment. And you can see they put the percentages there, and so that's how they got these numbers, and so we can see the measures. So first, let's look at Clatsop County's health outcomes. And as previous slide said, health outcome combine health, the length of life and the quality of life. So here you can see the length of life is the dark green, and the quality of life is a light green, darker green, lighter green, and this red one is the combination of the two. So when we talk about the ranking, we talk about this red line. It's a summary. So in this vertical axis, talking about ranking, and in the horizontal, we talk about Clatsop County in the ranking among 36 counties. So in the following most of slides, I will not go say these two axes again, and just to make it clear. Vertical is ranking, and on the top is better, and the lower is worse. And these are from the first year ranking 2010 to this year. So we can see the county overall at health outcome, yes, doing well or even doing better after some years drop, and we are keep there. Okay, and as for what's the definition of length of health and quality of health, or quality of life and the length of life, and usually we say length of life is community lost every year, how many premature deaths, life lost. Premature deaths defined as every life expected to live up to 75 years. If somebody die in 55, the community lost 10 or 20 years.
Hey,
And
Jen
the
Chang,
qua-
Jen
Yeah.
Chang, I was wondering, is it possible to share full screen? Because I can't see the last few years just because of the format of the
Okay.
Zoom
let me
call. Just
see.
it cuts it off there with everybody's picture. I don't know if others are seeing that, but I was just
Can you
curious.
see now?
Is it just me? Okay. But you can
Okay.
go ahead and go back to it.
Okay.
Go
so-
ahead.
Jen Chang, if you choose slideshow up at the
Right.
top,
Slideshow, okay.
Slideshow.
slideshow
Yeah.
Oh,
right
okay.
there. And there,
Can you see slideshow now?
choose slideshow and then current slide.
Okay, slideshow. And
And
show,
from current
From
slide
current
over on the
slide,
left
right over-
there,
yeah.
the second from the left. Second from the left here.
second to the last.
Second all the way to the end there, second from the left. The second one,
Oh, here,
No, we're, okay,
Is
so
it
up
here?
top it says slideshow.
the slideshow on
And
the
then
top.
over on the far left of your screen, it says from beginning.
Yeah,
Choose the second one
okay,
from
There you
current
go.
slide. Oh, okay,
Oh,
that's
you
not
see the
working.
full screen? Okay.
yeah, it's
So-
okay. I was
Yeah.
wondering if we could see it.
So this about quality of life and they call county residents and look at their reporting health, mental health, and the physical health status. So at the top left, you can see 2023 and Clatsop County is at the second percentile, and it's you can see here we are 15, and it's here. And the next slide is about health factors, and still this red one is the summary. But as you know, because this health factors combine 4 components. So 4 components I put here, and you can see this is health behavior, light blue, and the clinical services is light brown. And this green is health economic factors. And physical environment is black. And I want to say, yes, not to be surprised. And this black up down a lot, and later I will explain. And really, because over these years and the rankers, they change their indicator a lot of times. So that's why, and this up down a lot, but we can see overall in recent years, and it's in an improving situation. And for health factors, and we Clatsop County the same at the second quartile, and it's also 14, 15. It's as a Lulu community, Lulu County, we're doing great. I wanted to say this is really our opportunity. Work make the county a healthier place. But also, before I move forward, and I want you pay attention to this map. And this is something I say, this is our Lulu County's challenge, because you can see the top quartile from top 1 to top 9, 7 of them in this you call valley area, and I call it a corridor. State put more resources there, and very few other county is doing so good. And one example it's also a rural county I can share with you. And this is Wallowa County. And why they are doing so good in this rural county? And yes, they are really did a great job. Is they have lower premature deaths than our county. They have higher graduation, middle school, high school graduation rates. They have lower STD rates. They have lower teenager birth rates. So compared to these two rural counties, yes, I think they are doing a great job. But still, when I go through these 4 factors, and I will share with you, and still we have a lot of opportunity to work together. And because these factors so complicated and really, another challenge is no single agency can do them all. And the hope for our Clatsop County is really, I think COVID bring our county agency work together. And just like Sheriff previous his presentation said, the whole community need to work together to make changes. And COVID really bring our community together. And so this is something it's our hope, and we work together and get our community health improved. So here, this is the slides, and you can see health behaviors. And health behaviors, you can see include adult smoking rate, excessive drinking, STD, and the teen births. Teen births, yes, were relatively stable. It's good. And the challenge is really our ranking is high, and it's not in a good condition. And this, yes, talk about the ranking. If you look at over these past 10 years, percentage rate for adults smoking is reduced, but we talking about ranking. It's not a percentage of smoking. Some county, if they do better, and still every county reduce their smoking rates. But if we slow than other county, our ranking getting worse. So this is something, yes, it's something smoking and the drug, we need to work together. And the next slide is also health behavior. And health behavior, obesity is light brown, and green is a food environment index. This is a little bit complex, and this is more talking about healthy food in the community, accessibility, and physical activity, physical inactivity, and talking about this in the county, access outdoor, indoor physical exercises. And the lighter blue is access to exercise opportunity. Oh, physical inactivity is, yes, sedative behavior, and people with little physical activity, it's behavior. And light green is access to physical exercises. So because some measures like food environment and access to exercises opportunity in first several years, they're in environment, measure as environment. So this started not at the beginning, and these changes too much, and I just eliminated them. And clinical care, we have bigger challenges here. And let me put it here. And clinical care included insurance and health care, and also some healthcare services. Here you can see uninsured adults. This is orange line, and dark blue, primary care physician rates towards population, and the light blue is dentist compared with total population, and the green is the mammogram. So you can see our community we have challenges in getting providers and our ranking getting low. This means, yes, we have increased one physician, one dentist to take care of more our residents. So these are challenges. And the mammogram screening rate up and down a lot, and it's not in a good trend in recent years. Socioeconomic factors, and here include the 3 factors there. High school graduation, and this green one is income inequity, and this dark blue one is unemployment. And so you can see really COVID hit our community here, you can see, and we all affected. And yeah, socioeconomic. And let me talk about physical environment here. Physical environment, as I said, I eliminated these early years. Air quality is great. And I know the biggest question, still I have question, is severe housing problem. This orange line and look very good and keep increasing over the years. Here I want to make some notes here. This is severe housing problem is not just a look at the housing market, and the measure, the rankers they measure include household ownership and the severe housing problem, and also they look at costly housing repair needs and whether housing unit has kitchen or housing unit has this toilets. So these put a lot of other factors there. So it's not really directly reflected. We saw a lot of homeless because of housing market issues. And the purple and the green one are commute, and the one drive along this are green, and the purple one is long distance driving. So you can see during COVID and this reduced. So this is completely talking about ranking, and the following slides will be a little bit different, and talking about our community health disparities. And so here also these slides data from the health ranking website, but the vertical changed. Vertical axis is percentage, and the horizontal still the years. The following 4 or 5 slides will be the same, and I just wanted to share with you and to see what's the health disparity in our community with these slides. And so you can see health disparity at a low birth weight, and the community doing very well, and it's almost white and Hispanic population. They're almost the same in recent years. Teen birth rate and Hispanic population is higher than white population. But if we compare to the beginning, they space, and it's in a good trend, and reduce this birth rates. And mammogram screening, and here this green line is Asian population, and they have more data. So you can see was in a good trends, and but probably because of COVID and this all in a downtrend, all population quite consistent. And So this really, you can see another evidence. This COVID affected our community's health. This is another example. And we don't know for what reason, and the flu vaccine reduced during this COVID for Asian population, but for Hispanic and the white population, a slight increase and some quite increase during the COVID. So children in poverty, and this is something you can see during COVID, and we had some gain and then quickly lost. And this is something I think this is a good example. In the public health, we do not have the answer, and we need to work with community, work together, and look at health is not just doctor and health insurance, it's social determinants of health. So these are the slides I prepared, and you must have questions, and I leave this to your questions.
Thank you. Yeah, thank you, Jincheng. Commissioner Thompson.
Well, isn't this just brilliant? Jincheng, thank you so much for all of this data. Now, our challenge is, I think, how do we integrate, how do we incorporate this so that we, I want to say, set public policies. I don't know if the Rec Lands Committee has a calling to improve its standing and its funding, but I'm trying to think, okay, now that you've given us this data, these data, how do we use them to have a healthier, happier county? And I don't, that's kind of an open-ended question. I'm not looking for a response now. It's just how I'm thinking to myself as we go forward.
Commissioner Thompson, I still want to bring COVID back to the topic. Is really because COVID truly bring the whole community together. And one example I can share with you, and talking about how to improve community health and hospital, they are very much aware of why we have high community, why we have early deaths. And the reason was really because for some unknown reason, many residents, they go to see doctor with third, fourth stage of cancer. So hospital now work with our health department, and we are trying to promote this called Springwise, and encourage people get a screening. And this way, we don't need to wait the patient till third, fourth stage and get. And another thing we can do is really, I think we have health promotion team, and how we promote reduce tobacco use, reduce vaping, because tobacco is the most preventable cause of death. So these are something I think, yes, in the community, different agencies work together, and we will make health condition better. So this is really, it's a collaborative partnership efforts. And also go back to the slides, and really, if you can, commissioners, if you can really persuade the state and give the funding scale tilted towards rural area. This is something I always say started when I was in Maine. I said to CDC, I said, no, you give population-based funding is not to make sense. I always give them example. I say, if you go to give me a car, I drive around the Rhode Island. 4 hours, I can make a circle. If you give me a car in Maine, I drive from South Maine to Northern Maine. It's 10, 11 hours. So I said to them, no, your funding mechanism not make sense. Here, I want to make the same argument. State put their funding or other resources in this valley area. This is not make sense. And it's put this rural counties in a huge disadvantage.
Yeah.
Mr. Follow-up?
Go ahead, Commissioner Thompson.
Thank you, sir. Well, okay, so Jen Chang, I do have a liaison seat with the local government advisory committee, and that meeting is Friday, the day after tomorrow. So if you can prepare an email for me, or we can have a conversation, maybe both. I have access at the state level with the leadership of the Oregon Health Authority and Department of Human Services. That's at the state level. At the local level, Chair Quila, we still don't have a seat on that coordinated care organization. Commissioner Webb, I don't know what I can keep trying, but that seems to me the two-pronged approach we need to take is to be at the table with voice and vote for our CCO, and then in those statewide leadership meetings. So I'll do what I can if you give me clear and specific instructions.
I would drop an email and send it to county administrators, let them review and forward it to you. Thank you.
Absolutely. Protocol
Thank you, Commissioner
and all of
Thompson.
that. Thank you.
Thank you.
Any other questions, comments? Yeah, fascinating data to review, Jen Chang. I really appreciate you presenting it, and certainly knowledge is power. So this helps us going forward. And I agree that we can have some further discussions about, what other avenues we can take to make progress. And I think the CCO is certainly something we need to reconstitute and make sure that we're asserting our effort to make sure we have a seat on the CCO. Commissioner Webb.
Yeah, I think that maybe at our further meetings on our strategic plan, we might want to begin with this presentation. I think it gives us a wonderful picture of the state of the county, health-wise, and I think it's something that we need to incorporate into our strategic planning. Thank you.
Yes, good idea, Commissioner Webb. Anything else? Yin-Cheng Wong, our Community Health Director, thank you very much for the presentation. Appreciate everything that you do, and the rest of your department as well.
Thank you very much.
Okay, last item is the FEMA BIOP. We have a letter that's been drafted, that's been sent to us to review, and our Community Development Director, Gail Henriksen, is here, and she can discuss more. Gail.
Thank you, Chair and board members. Just briefly, back in September or November, I had the opportunity to address your board and give you a very broad and general overview of this FEMA biological opinion and the process that we have now find ourselves in. And after that happened in November, the environmental impact statement went out for a NEPA, National Environmental Protection Agency review. And comments were submitted by your board along with many of the cities here in Clatsop County and jurisdictions across the state. And following that initial public comment period, it was extended, as the county manager said, till June 26th. And so when we have been having our staff discussions and looking at this and meeting with some of the Tillamook County staff, we decided to put together a second comment letter for your board that would take a more regional approach for Clatsop County. And that letter is intended to incorporate and bring together not only your board, but also the mayors and the county council or city councils for the 5 cities that are here in the county. And so we put this forward. The county manager has also forwarded it to the city managers for their review and discussion with their councils. But we wanted to get some input and direction from your board today. If this is something that you would like to submit, and if so, did you have any corrections or changes that you would like staff to address? And really, I'm here to answer any questions you have and really take notes on what direction you give us. So thank you.
Thank you. Do we have any? I see the Commissioner Webb. Commissioner Webb.
Yes, thank you. Thank you, Gail. I have now attended 2 of these FEMA meetings. And with one of them with our colleague, Mayor Balanciefer in Warrenton. It seems that lately we have been looking at a lot of maps, the sea level rise maps. These FEMA maps, I think, are nothing new for us. But what I object to most in this process is that they have come up with a very complicated process. It's a 4-step process. Excuse me, Gail, that's wrong, isn't it? It's not a 4-step. It's a 4 options that local communities can undertake. Actually, I would love for the whole board to be able to receive one of these FEMA presentations, because I think that what it points out is how complicated the process is going to be for us to be able to even address the issues that are being raised. And they're really complex. I mean, we've been dealing with flood insurance, et cetera, for what, 50 years now in this country, and we've managed it. We've still put much too much development in floodplains, but now, and I guess I have 2 strong feelings about the letter. First of all, I think we should begin by saying that we are very sympathetic with what is trying to be accomplished here from an environmental standpoint. We have a crisis in Clatsop County about the survival of salmonids, and we have to address this. We have a fishing industry that is being increasingly fishing, and I mean all aspects of fishing and canning and exporting, that are being terribly impacted by our plunging counts of salmonids, and we're worried about this. So I think we need to express the fact that we have no issues with the fact that we're in an environmental crisis. What we have issues with is that what FEMA is asking us to do in terms of accommodating our local development codes is awe-inspiring. I mean, it requires the kinds of technical data that we just simply do not have and probably can't afford to get. It's a really onerous challenge for us. And so, as I say, I would first of all love to have us say, hey, folks, we don't object to preserving the ecological surroundings of our fabulous communities. And we want to do this. We want to help. But good grief, we have 4 cities in this county under 10,000 population. With one or occasionally a half of another planner. This is just a very onerous bit of calisthenics for us to go through. I did pinpoint a couple of, I think in the second paragraph, the 4th line, saying that that this has created a confluence of development prohibitive requirements. I don't think these are development prohibitive requirements. I think that what is prohibitive are the local changes to our and the scientific input to our local plans that they're requiring us to do. And I do agree. I mean, if you look at the Warrenton map, yes, then that is probably development prohibitive. But I really feel strongly that we need to express the fact that we're not opposed to a strong commitment to the survival of our very rich species in Clatsop County. What we object to are I think actually what whoever wrote this, I assume it's Gail, on the second page, the first paragraph, the fourth line, where it says, it is therefore impossible for our jurisdictions to identify, let alone quantify, the economic, social, or health impacts of this EIS. And to me, that's the essence of what we're trying to say here, is that it's just a bridge too far. We don't have the resources to complete. They've given us these 4 different ways to become compliant with the FEMA regulations. And to me, I don't think we can afford to do any of these. They're massive scientific data that they're asking us for. I think I'll stop my rant now. Thank you. Oh, my other great support is that I love the idea of doing it countywide. Because this is a higher burden on our cities because they have the density. In floodplains, we too have issues, but I really like the idea of doing it cooperatively with our cities, not with other counties, but I very much support doing it with our cities and speaking as one voice, especially since our cities are at their UGB levels right now, and I think we need to work very closely with them on this. Sorry to be so passionate. No, I'm not sorry to be passionate about it, but I am sorry to speak so passionately. I think this is enormous for us. I think this is an example of federal overreach that may be in my professional lifetime the most extreme example of federal overreach that I've ever seen. Thank you.
Thank you, Commissioner Webb. Commissioner Thompson.
Well, to follow that, in one of those meetings, I asked if the case about wetlands over in Idaho would have an impact on this, and they said, "Oh no." Well, to Commissioner Webb's point about overreach, yeah, there is developing a rebound on overreach, and isn't that just a shame? Because everybody knows we've got real problems here. You know, the salmon aren't just an industry, they're iconic cultural linchpins of our whole existence here. I mean, so yes, we do share. Yes, this is an impossible standard. My hunch is that the federal government is attempting to do a beta version on Oregon, and what they're going to do is test out and see what sticks to the wall. I would only disagree slightly with Commissioner Webb, because I think it absolutely does prohibit us, because we don't have the money, number one. And number two, this won't be a one and done with the science. It will be a constantly maintained and updated course of action, because we're in a fluid, dynamic universe that is going to keep changing. We are going to keep seeing climate change. We are going to keep seeing species extinction. We're going to keep seeing these issues with rich and poor. So I like the letter. I might rearrange to put the 2 points up at the beginning, which is, yes, we absolutely are committed to the preservation of endangered species, particularly our iconic salmonids. But number two, this is now and will continue to be for the foreseeable future prohibitive, because we cannot afford to implement or maintain the level of science required to do this. So there has to be a different way to proceed. Other than that, heck yeah, send a letter, get a group, go forward. Well done. Signing on. Thank you.
Thank you, Commissioner Thompson. And I don't mind that we have a qualifier about that we are trying to do everything we can to preserve ESA and endangered species. But I do think this needs to be forceful. I think that for all the reasons that have been mentioned, this is a huge overreach and, in my mind, very development prohibitive. And I also believe that in a lot of cases, it doesn't help salmons. I don't know that in all cases where you have levied areas that are now going to be judged as though they are part of the floodplain, even though they have been levied for 100 years, that necessarily helps salmon. So I definitely want to, I lived in Warrenton my whole life, so I know what Warrenton struggles with when 80% of the entire city kind of impacted by this type of an action. And I do want Mayor Balanceford to feel like this is something that he can strongly support, that it does have the teeth in it that says that, that we are committed to trying to fight this, because we, for all the reasons that have been mentioned, think this is bad policy, and it certainly will be punitive to Clatsop County and to small rural communities like ours. So I'm for sending the letter, absolutely. County Manager.
Chair Quillen, members of the board, sorry I had technical difficulties, so I missed the entire conversation up till about a minute ago. So I apologize for that. But what I will say, just as a little update, the draft letter was sent to the city managers who shared it with the cities. And so far, Seaside, Warrenton, and Astoria are good with the letter. We can certainly make other modifications at your board's direction, and that's the part of the conversation that I missed. Sorry. But so far we've heard from 3 out of the 5 cities. So just wanted to share that.
Yeah, that's great. I'm glad, and we certainly want to have unanimity of support on this. And it's great. Any other comments, questions? Okay. Thank you, Gail. Anything else that we want to discuss today in the work session? Are we good? Okay, we'll go ahead and adjourn. Have a good rest of your Wednesday.